Hi, everybody. Welcome to another show of Mind Mining from MPMS. And today we have Songbriti Nath, who is a psychologist, counselor, mental health expert, writer, and artist. How are you, Song, today?
I am doing okay. How are you?
I'm doing good as well. And how's everything going at Kolkata? Kolkata mein kaisa chal raha hai? You're from Kolkata, right?
Right.
Yeah.
It's going, I really don't know what's going on outside because I've been at home most of the time. So I think
Okay.
for me, it's going okay at home.
So let's not waste any time and let's just jump into the topic of discussion today, that is psychology 101. And जैसे कि तुमने बताया कि I believe today, tomorrow, that's on 10th, that is a World Mental Health Day, is it?
Absolutely, yes, yes.
Okay, तो होता क्या है? Like basically, how do you guys even like spread the message कि like Mental Health Day है आज, and like what do you guys do actually? Like what do psychologists do basically?
So आप अगर मुझसे मेरा पर्सनल ओपिनियन पूछो, so I feel that mental health awareness should go way beyond one particular day.
Certainly.
But yes, that we have this one day where okay fine, सारे लोग जानते हैं कि like we have, हाँ एक किसी का बर्थडे हो गया, वुमेन्स डे हो गया, तो मतलब वो एक पर्पस है. बट आई थिंक इट शुड गो बियॉन्ड द पर्पस. सो मेंटल हेल्थ डे का इस टाइम का जो एक थीम होता है ना, हर ईयर वी हैव अ पर्टिकुलर थीम.
Okay.
So this year the theme is mental health in an unequal world. So you see what happens is most of the people from middle income countries or low income countries, 75 to 95% of the people with mental disorders there don't really have access to mental health resources. In low income countries or in middle income countries, it's a difficult thing. But having said that, it's not even like in the higher income countries, it's a very good deal there. ऐसा भी नहीं है.
Okay, and it's basically ki like kal mental health day hai, and spreading the awareness is also can be considered, right?
Right.
Okay, all right, that makes a lot of sense. And which brings me to my first question, Song, is there any difference ki like psychologist alag hai and psychiatrist alag hai? And like, because there are two terms, right? And I often get confused. So like, what is it all about? Like psychologist and a psychiatrist?
A psychiatrist is a doctor in the sense that he has a medical degree. तो वो लोग जो है MBBS करते हैं and then they go to specialize in psychiatry, है ना?
Okay, all right, that is interesting. Okay, and what about a psychologist?
And for psychologists, what we do is we assess. We can assess and we can do diagnosis. Also, diagnosis is something that only clinical psychologists can do.
Okay.
And psychologists specifically focus on psychotherapy.
Okay, that is interesting. And psychotherapy would include like different types of practices and counseling and all, is it?
Yes, psychotherapy, if you look at it, like in simple ways, it'll be where, you're having, it's about talk therapy. So psychotherapy, maybe you have different kind of approaches that you can use. So like say someone would want to work on a CBT approach, or CBT would be cognitive behavioral therapy. Or someone would want to take let's say we have this DBT, that is dialectical behavior therapy. So there are different kind of approaches that you would want to take. So ये मतलब depend करता है कि आप कौन सा approach लेना चाहते हो.
Okay, and this is super interesting, and it is all related to like tumhara, like how you're mentally, like what is your mental state basically, right? Like tumhara mental health kaisa hai, and are you feeling kind of depressed, or like how do you even assess it? Like tum pata kaise chalta hai tumhe?
ये बहुत अच्छा सवाल पूछा आपने. पहली बात तो it's like जैसा होता है ना, अभी हमको if I have a stomach pain, all right? So I know that I have a stomach pain, but I don't go along diagnosing that हाँ मतलब मेरे पेट में अभी अल्सर हो गया. ऐसा तो मतलब मैं नहीं करती at least. So what I do is I know I have stomach pain. I need to go to the doctor. है ना? So same way, what in terms of your mental health. Okay. When, like you said, like if I'm feeling sad, everybody feels a normal amount of sad.
True.
But now when I see that because of this particular feeling that I'm feeling, I go, I cannot eat very well. My appetite has either increased or decreased. या फिर आप जो है ना, मेरे जो डेली एक्टिविटीज में माय वर्क लाइफ हैज बीन सिवियरली अफेक्टेड, my sleep
Okay.
pattern has changed, like if I'm supposed to sleep at 10 in the night, I'm sleeping at 3 in the night.
Okay, और तो
So
physically भी कुछ changes हो जाते हैं basically. मतलब there's some changes in your behavior. Is that what you're trying to say? Or your health?
yes, yes,
Okay.
there will be three
Hmm.
changes. आपको दिखेगा इमोशनली आपके चेंजेस हो रहे हैं, like say you are easily irritated, or to
Okay.
behavior wise, how you interact with others, that way how you are maybe responding to somebody. And then we come to the the biological side of it, जो आपने अभी कहा ना, there can be some
हाँ.
physical changes too, like you can be feeling severe pain in some part of your body. So wo, now that you brought out the topic of how do I know if I'm sad or
Hmm.
I'm depressed,
Hmm.
या फिर अगर मुझे actually कुछ mental illness है that
Hmm.
needs to be addressed.
Okay.
So
All
to
right.
clarify this, we have to actually go to a mental health professional.
All right. Okay, now it all makes sense, and now I can connect all the dots. And what about depression? Like क्या होता है? Like, see, I've heard lots about depression, and वो movie बना था, right? What do you call that? जिंदगी? No, not what was that movie जो गोवा में shoot हुआ था, शाहरुख खान था and all that.
This is Dear Zindagi.
Dear Zindagi, right? तो वो मूवी बनाता है, and that's how like I mean I saw that movie, and come on, I also knew कि like चलो depression actually लोगों का होता है, and it's sometimes it can be so severe कि like it might turn into suicidal and all that, and you might get addicted to stuff and all. But how do you actually handle depression, like you as a psychologist? Like अगर कोई तुम्हारे पास आता है and you actually realize कि this is a severe case of depression and anything beyond this could lead to something dangerous, right? So what would you like, how do you tackle that? Like what do you do?
Okay, so any psychologist, severe cases of जब आप clinical depression की बातें कर रहे हो,
Hmm.
then that is something that is dealt by a clinical psychologist, है ना?
Okay.
So so what happens here is that you use, in depression, you have to remember that here there are biological factors that's playing a role. So there you might require psychiatric medication. So you need medication as well as therapy to work hand in hand. So here the thing that what I understand is that you address the symptoms. So say in depression you have like you don't get enough sleep, or your appetite is extremely low, and then जो भी हमारे depression के जो symptoms है,
Hmm.
once you begin addressing that, it's not about like having a total like you go to a psychiatrist and you get all the solutions, or you go to a psychologist and you get all the solutions. It's that you learn to manage all of these symptoms.
Okay, so you're
And
trying
I
to say
like
कि
you.
like permanently खत्म नहीं होगा, like you cannot completely get rid of it. That is that what you're trying to say?
What I'm trying to say is that जो आपका जो like now depression, they say that there is medication, there is psychotherapy, yes,
Hmm.
huh? But there could be a chance of relapse also, है ना?
Okay. हाँ.
Yeah, so वो मतलब कि वापस आ सकता है.
Okay.
And it is something that you learn to like manage the symptoms here. Like say for example, क्या होता है कि यहाँ पे आपको you'll feel a loss of energy, which again could have some biological factor associated with it. Then you will be having feelings of worthlessness. फिर जैसे आपने कुछ देर पहले कहा था that you might be having suicidal thoughts. That also comes under depressive symptoms.
Okay, and it can be treated both by like तुम्हारा medication and also by like therapy, right?
हाँ. It can be treated by both, but जो यहाँ पे होता है ना, like people say either psychiatrist or psychologist. But अगर आप दोनों like दोनों के साथ like आप psychiatric medication भी लो plus you go for psychotherapy. So it's like you get a complementary kind of a treatment.
Okay. So both combined together would definitely should like help out, right?
Yeah. And depression, when we talk about depression, yes, it is treatable. But you have to, like like we take care of our physical health.
Yeah.
You will have to be, it's a lot of hard work. So going to therapy, or even being constant with taking your medication on time, all of that has to be done.
Okay, all right. And I've also seen song ki like ऐसा भी होता है, some people go for like this clinical therapy for years. Like मतलब
Mm-hmm.
like ऐसा नहीं है कि like महीना 2 महीना भर तुमने दवाई ले लिया and then तुम ठीक हो गए. Sometimes it tend to last for like years and years. So is it true like लोग इतने साल like does it like really have to be like years together like therapy?
ये ना डिपेंड करता है एंड इट कुड बी सो थेरेपी का भी ये व्हाट आई अंडरस्टैंड फ्रॉम माय पर्सनल ओपिनियन इज किसी इंसान को थेरेपी शायद 1 महीने के लिए चाहिए समवन माइट जस्ट नीड इट फॉर अ वीक
Okay.
or some person would maybe need it for their entire life and that's okay. If at all a person is having depression and they need to go to a mental health professional every week, I think that's okay. Agar lifelong bhi aapko chahiye aapke it's for your health, right?
Yeah. So it's
I
worth
don't
it.
know.
That is true. I mean, it would definitely be worth it if it's making you feel better. And जो and अगर कोई psychiatrist तुमको कोई दवा देता है and would it because see क्योंकि वो पेन किलर नहीं है, right? I'm pretty much sure it would not act as a pain killer because there is something that is going in your brain and you're taking medication which is helping you probably like chemically generate some dopamine, maybe. I don't know, I'm just like guessing here. So do you recommend like ye dawai wagera for like your mental illness? Like I don't
Yes,
I have no idea about it, by the way. I'm just shooting in the dark and I just want to know, that's all.
no. This is good that we're having conversations like these.
Yeah.
The thing with psychiatric medication also is that it's very stigmatized. लोग बोलते हैं ना कि like आप psychiatric medication लोगे इसके side effects होंगे.
हाँ, that's what I feel. Honestly, I mean, I don't know, maybe कि news में देख के लगता है, I have no idea, ठीक है. But I do have that like feeling कि चलो अगर मैं depression का दवाई लेता हूँ तो I might get addicted to it या फिर it would definitely have side effects. So is it true?
Now the thing is we have to do this and पहली बात तो you will not get a medication जैसे अगर you don't have a particular prescription from a psychiatrist, they will not give you that medicine in the shop, है ना, आपको नहीं मिलेगा वो दवाई.
Certainly, exactly.
हाँ तो एक बारी you have to constantly take follow-ups from the psychiatrist that okay what is the amount of dose that I need for one particular medicine, chahe it's for anxiety or you take it for depression or for any other mental illness. So to be under the guidance of a doctor, and like you said that okay do we get addicted to that, are there side effects, like I was saying people think that there might be side effects.
Yeah.
Now if we are feeling certain side effects, that also has to be taken to the doctor's chamber and you have to talk about it that yeah these are the side effects I'm facing, and then that person is the expert and he knows what to do after that.
Okay, all right, and that's how it works out, right? So अगर side effects हैं भी तो you should be like upfront with your psychiatrist या फिर and then like just be open about कि like चलो मुझे ये side effects हो रहे हैं and based on that the psychiatrist will probably like take other actions, right?
हाँ जैसे कि even जैसे एलोपैथी, जब आप एलोपैथी टैबलेट्स लेते हो there are side effects, right?
Yeah, true.
There are certain like some tablets make you feel very sleepy, like I know for sure allergy tablets because I take them. I know allergy tablets make me feel really sleepy.
That is true.
So that's one side effect I have noticed. Similarly इसका भी जो है हाँ बोलो आप.
नहीं मैं वही पूछ रहा था कि like long term basis में अगर तुम continue करोगे तो that would probably like damage you somehow, is it? Like if you take it for a really long term like time, sorry.
हाँ अभी really long time, this is like when you have say one ailment, say अगर आपको chemotherapy लेना है, so you will have to continue it, right? Even though there are certain side effects.
Okay.
Now same with psychiatric medication also, that's why I am again like repeating myself कि do this under the guidance of a psychiatrist, because a lot of time मैंने क्या notice किया है, people start with psychiatric medication and they just stop on their own, खुद ही stop हो जाते हैं.
Okay.
या फिर like so like they just stop on their own, so this isn't very good, या फिर मतलब ये करना नहीं चाहिए क्योंकि you're not the expert. In fact, I am also not the expert when it comes to medicine. So the person who has, worked so hard and achieved that degree of his or her, let that person do the job now.
Yeah, okay, that makes sense. That definitely makes sense. As a human, what I actually want to do is be happy, right? So talking about happiness, like, do you think it can be like chemically induced, or are there any practice for being a happy person? Basically, that's what I want to know.
Dekho, that's the thing. The fun fact is, which you said, it's not possible to be happy all the time.
Or
है ना?
true, so true.
We cannot be happy all the time. Happiness now, what is this happiness? It's a particular emotional state. So all the time हम खुश नहीं रह सकते हैं. But apart from happiness, we have to also understand that there are these other emotions also जो हमारे अंदर है. वो sadness है, वो anger है, वो fear है, ये भी है हमारे अंदर.
And yeah, go ahead.
So accepting all of these emotions is as important as, this thing of, okay, I want to be happy. I want to be happy. Of course, all of us want to be happy.
Yeah, that's exactly.
But uska matlab ye nahi hai ki you will not have circumstances where, you will be sad. Like, say, for example, the death of a loved one. How can you expect you will be happy at that time, or I will be happy at that time?
Yeah. So basically, like if I give you some kind of meter या फिर on a scale, ठीक है, अगर एक scale है, so I obviously like being happy all the time is definitely not possible, and there will be instances where you will be sad, right? But what should we do as human कि वो happiness meter जो है always like it moves up या फिर like नीचे नहीं जाए, and it moves up and it stays up and gives you some kind of positiveness. So what should we do about it? Like how to like make sure कि like हम ज़्यादा से ज़्यादा time like happy रहे? I mean, is it subjective, or like it does it depend to like various persons, or like what's the scene?
When you talk about subjective, no, so यहाँ पे हमारा एक term भी आता है related to this whole happiness thing of subjective well-being. Okay, so now the thing is that it all depends on one particular person's overall feeling ki now how is my life. So your view might be something else, my view might be something else, XYZ person's view might be something else.
Yeah.
This whole thing of subjective well-being, it's on how, your particular overall, like you as an individual, what's your overall personal feeling about your life right now. So now in happiness, what happens is if your life is satisfactory, say for example your relationship is doing good, your work life is fine, कोई वहाँ पे कोई दिक्कत नहीं है, achievements ठीक हो रहे हैं, so life satisfaction है वहाँ पे, है ना? Then you have emotions where now both there are positive emotions, there are negative emotions, there is different up mood, कभी ऊपर रहता है कभी नीचे रहता है इंसान का.
That is true.
So happiness is now linked to all of these factors. So if you know that your life is satisfactory, work ठीक चल रहा है, आपका relationship में कोई problem नहीं आ रहा है, you as a person you're keeping physically well, so then there's a higher chance of being of this whole well-being that we're talking about.
Okay.
आप इसको happiness कह लो, आप इसको subjective मतलब आप इसको well-being कह लो, जो भी कह लो, it's there. Now जो हम देखते हैं कि we are like हमको हमेशा खुश रहना है, वो तो नहीं possible है, but हाँ majority of the times मेरा क्या चल रहा है. But yes, this whole concept of happiness is very what you tell. I can't just talk about it in these few sentences, because when I say it's about now again it could become contradictory, because of course like I think about something in the past or in the future, then that starts making me feel anxious, or I start feeling bad about what happened maybe years ago, some incident that's going to affect my present. So this is a very complicated thing that कुछ definitions में तो हम नहीं define कर सकते.
Certainly, I totally agree. And coming back to therapy again, because I'm like super interested in therapy, ठीक है? And basically, what do you think? Like, I don't know कि like say, because it's not something that you physically take, right? It's just like two-way conversation that you have with an expert, and things tend to seem better, like just after having a conversation. And I find it like, since there is no physical thing involved, like तुम्हारा हाथ नहीं काट रहा है, तुमको like, counseling में especially तुमको कोई दवाई नहीं दे रहा है, and you just talk to the other person and you tend to feel better, right? So like how this therapy works, like मुझे समझ में नहीं आता है, like you just talk to some random person about your feelings and what's going in your life, and it all of a sudden makes you feel good. Like it's strange.
Yeah. It doesn't make you feel good all the time. That's the thing. You don't feel good.
Okay.
So this thing, when you go to therapy first,
I've never
and
been
when
to,
you start,
yeah, go ahead.
When you start talking about all your fears and what you're insecure about, and childhood trauma and all of that, it's not a very fun feeling, and you don't feel like, wow, मुझे कितना अच्छा लग रहा है. मतलब
तो उसके बाद से तो, so if you feel कि like अगर तुमको, you suppose I went to therapy, ठीक है, and I told all my weaknesses, all my fears, ठीक है, and then I'll feel vulnerable, right? कि like I've told all of my important, like जो भी मुझे डर लगता है या फिर the things that I'm shit scared of, I just told to some random, like I just told to a stranger. And don't you think that will leave me in a vulnerable state कि like I would not like to go there again, and or I would not like to encounter that a person again. मैंने उसको सब कुछ बता दिया है, and seeing him in somewhere else, I will feel shy, या फिर I will feel,
I got your question. So your thing is that, say I go in, I'm showing you, my therapist, all of the vulnerabilities that I have emotionally, है ना? So the thing here is, I understand that any person, even me for that matter, if I go to a stranger, that person, talking out all of my vulnerabilities will not be easy.
Yeah, definitely.
So the therapist also has to be patient for this particular person to open up and to accept that human beings are vulnerable. Matlab, any therapist who is a qualified therapist will understand this. These are the basics, that human beings are vulnerable. It will take time for people to open up. And yes, which you have just pointed out, that first session I go, or 2-3 sessions where I share everything, then I don't want to go back. So when you have these kind of feelings, it is like suggested you bring this out into your therapy. You tell your therapist that I have been feeling this way. That now also a very important point, that legally a therapist is not supposed to make BBC News out of your information. So your emotions, your stories remains with the therapist, unless there are certain other laws and regulations, like if somebody is suicidal या फिर किसी का crime से related कुछ है, then they might have to give out the information. Other than that, that confidentiality, what we call it, that agreement, it's never broken.
Okay, so there are clause, and there are, like, basically it is confidential. And what if you meet your psychologist in a public, or suppose in a party, and then also the psychologist cannot bring whatever happened in the session, is it?
No, they can't. And in fact, this thing of, say you're from the same city as your therapist, you know that there will be chances of meeting each other. Your therapist itself will, herself or himself will clarify this, that, if we happen to meet at this particular place, I will, we might just share a hi, and then I might move on. But let's say you have not discussed this in therapy, and by chance you see your therapist in the road, and the therapist just shares a smile, or just walks past you. That's because to maintain your confidentiality. That person would not, if you don't want people to know you're into therapy, or this is the relationship you share with this professional, the professional will not let the the people around know.
Certainly.
And anyway, if you see the person outside, you establish this, that when we meet outside, or if we coincidentally clash into one another in the road, we maybe just share a smile and move ahead to maintain the confidentiality of this whole process.
Okay, all right, yes, got it. And that clarifies a lot of things, Song. And I'm again so glad that I'm able to talk to you about this. And another scene I wanted to know कि like India में scene क्या है? Like, so I just wanted to know what's the state of psychology right now in India. I mean, like I just want to know कि like India में क्या चल रहा है, and are people taking it seriously, and what's going on?
India mein, what I understand is that we have a long way to go, but I think we have started, at least वो journey start हुआ है, so that gives me some amount of peace.
Okay.
But यहाँ पे ना मेरा एक perspective है.
Okay.
So what I see as per the data, and I'm going to like quote this to you. So according to the information by the Ministry of Health and Family Affairs, they say in 2018, आप guess करो India में there are 898 psychologists. Okay, this is as per the data.
Wait.
You just
898 you said?
Yeah, I said
The
898.
total number of psychologists in India in 2018 is 898. That's all.
Yeah, is 898. That's all. And the fun fact is, we need at least 20,250 psychologists right now.
Definitely.
So that's the least.
Oh my God, that's like, अगर तुम ratio में convert करोगे, it's like 0 is to like 10,000. Oh my God. So
like 1 lakh per population may I don't know the numbers itna, but matlab it's way less. Like it's horrible. Not just for psychologists, it's even in terms of jo psychiatric nurses jo hain, even they are mental health professionals. So they are 1,500 in number and we need 3,000.
Oh my God. I mean, that's that definitely gave me a picture that I didn't even imagine. And okay, so what do you think right now improve ho raha hai, like now in 2021? So like 3 years has passed. So do you like, is it improving or what's the state right now?
I diverted from that point. Yeah. So the thing is, I see a lot of awareness on social media that we need mental health is important, and please reach out to a professional and all of that. Now I don't know how much of that is being converted in the sense जब आप देखो कि how much financial investments are done in terms of mental health system in our country. वो एक हो गया. Second is when you see education.
Yeah.
Are there enough psychology students right now who are going to be future psychologists to make up for this shortage that we have?
I have no clue, and I mean it's just like I cannot even guess कि like अभी क्या चल रहा है, and maybe it's like extremely less also right now. I don't know. Like, do you think something else can be done to spread more awareness about how important is psychology to every human being?
Yes, I think we have to take this I feel this personally that we have to take it not only in terms of urban areas, but take this to rural areas also. And that will not happen only through social media. This has to happen in terms of awareness campaigns where we work on field.
Yeah.
Because most of social media posts might not reach people in the rural area.
That is true.
So and when we talk about India, we are talking about a huge amount of population that resides in this rural area.
Yeah.
So जब आप बात कर रहे थे ना, is mental health actually this whole scenario changing in India? So urban level pe at least we have moved somewhere. But then, when I see the news and I'm reading about farmer suicides and all of that, then I start questioning my, this whole process that are we moving ahead actually, or is it just there on social media? Like what's going on?
Yeah, so basically groundwork करना पड़ेगा, and then you actually have to go to all those places and spread the awareness, like physically वहाँ पे जाके, and probably like introduce this course early. Like I think like जैसे हमको जैसे साइंस आर्ट्स मैथ्स जैसे हम लोग पढ़ते थे 11 12 में, I think they should like introduce, or is it already there? I don't know, like actually like beginning में ये psychology introduce करने चाहिए by CPSE, ICSE and all these boards कि like देखो this is something that's actually important, and they should like start putting it in books, right? Like बचपन में ही. So that's what I feel. Or is it like already there?
मैंने इस बारे में I have actually written on this where
Okay.
I've mentioned that if you make mental health education a mandatory part of curriculum
Hmm.
in schools,
Hmm.
then as if we had, let's say, mental health education back then,
Hmm.
I think we all would have learned to accept failures better. We would have learned to be
Yeah,
aware of our
no.
minds back then. Khair, we didn't have that chance, but I hope that upcoming generations have mental health education as one of their subjects.
That is so true. And हम लोग को पता चल जाता है यार कि like okay, this is the moment I'm getting angry. I mean, we could have actually self-realized, right? कि like yeah, this would have been an amazing thing. And I just hope कि like government takes something or कुछ तो करे, just to make sure कि like psychology आ जाए बचपन से ही. And yes, it would definitely would help us to accept failures and know that not everybody is perfect, right? Hmm.
जब आप गवर्नमेंट की बात कर रहे हो, सो गवर्नमेंट का भी फायदा ही होगा. Why? Because when we talk about economically,
Mm-hmm.
because हाँ, government might be like, why should I invest in mental health, है ना?
Yeah.
कि क्यों क्यों करूं मैं?
Hmm.
सो यहाँ पे डेटा के अकॉर्डिंग अगर आप देखो तो वर्ल्ड हेल्थ ऑर्गेनाइजेशन, ये मैं नहीं बोल रही हूँ, दिस
Hmm.
इज वर्ल्ड हेल्थ ऑर्गेनाइजेशन, बोलता है कि 2012 से 2030 तक का जो हमारा जो इतना टाइम है,
हाँ.
इफ देर आर लाइक अभी का जो बिकॉज ऑफ मेंटल हेल्थ कंडीशंस जो है अभी,
Hmm.
इंडिया का जो इकोनॉमिक लॉस होगा, दैट इज 1.03 trillion US dollars, that much of
Oh
loss we
my
could face
God.
because of mental health conditions. मुझे तो इतनी मैथ भी नहीं आती, लाइक 1.03 ट्रिलियन में कितने जीरोस होते हैं मुझे ये भी
Oh
नहीं
my
पता.
God.
And
Billion
this
din,
is like
it's
you,
trillion. That's a crazy amount song. Like huge, huge. Oh shit. And
and this
I
is like in US dollars. Like imagine the
yeah.
loss we're going to face because of mental health conditions.
Shit.
So we better start investing in चाहे आप अभी हम डिस्कस कर रहे थे मेंटल हेल्थ एजुकेशन हो गया, या
हाँ.
फिर यू इन्वेस्ट इन हॉस्पिटल्स और
हाँ.
इन हायर स्टडीज
हाँ.
लाइक PhD एंड ऑल ऑफ दैट.
Mm-hmm.
प्लीज लाइक ये मेरा गवर्नमेंट को रिक्वेस्ट है कि इन्वेस्ट करना स्टार्ट कर दो. और आई डोंट सी लाइक वेरी what is it called, like India is going to be a superpower kind of a dream. I don't see that happening anytime soon. There is this mental health care act that is there,
Okay.
which says
Hmm.
that every citizen has a basic right to access resources, आप legal aid ले सकते हो, and all of
Hmm.
that is there.
Hmm.
Now this is there on paper. How much of that is being implemented, I don't know, like I really don't know.
That is so true song.
Because
मतलब चलता तो है ही
I
अंदर
will,
हाँ. Hmm.
नहीं
Go
नहीं,
ahead.
मैं
Go
आपको
ahead. Go ahead.
एक और
Go
हम
ahead.
मिलियंस और ट्रिलियंस की बात करें ना, तो I'll tell you one more thing. So government, as per the government, they
Hmm.
say they have invested 400 million on national mental health program. This I know they have done. Okay,
Okay.
this is 2020 का information, मतलब
Okay. हाँ.
हाँ. So यहाँ पे जो है 400 million sounds like a lot, right? Like wow,
It
400 million
is.
at least हमारा गवर्नमेंट कुछ तो कर रहा है नेशनल
Hmm.
मेंटल हेल्थ प्रोग्राम के लिए.
Hmm.
But just guess, per mental health patient
Hmm.
gets just 0.0146739 Indian rupees.
Shit, government should take like they should put more funding in mental health and counseling. Yeah, I mean they should definitely put more funds in there and definitely अगर वो लोग करेंगे तो they would not go in that trillion वाला loss also, right? But apart from that economic वाला scene, I really think they should start investing and putting more funds in counseling and make people understand कि like how important is this, right?
Also, coming to very important thing, insurance also, जो हमारा जो insurance covered होता है, हम घर पे सारे करा लेते हैं ना health के लिए.
That is true. हाँ.
I don't think they cover mental illness under insurances. I might मतलब मुझे तो नहीं लगता they cover, do they? Like insurance
I have no
companies.
idea. I'll certainly figure it out. And I don't think so. I think they only cover some kind of health diseases and maybe death, I guess. I
Like
don't
जो
know.
हमारा physical health का होता है ना, they cover that. They don't cover, if you have clinical depression, they are not going to give you insurance for that.
Shit. And I think they
And
should do it.
they're not going to give you insurance for that. But India में death by suicides का number, it is way so high that मतलब I don't know how are they ignoring this part of it.
So what do you think? Like gender में is there any kind of difference that you see कि like men are facing more या फिर women are facing more cases of depression? So do you think it is like gender driven also by any chance?
इसका क्लियरली मुझे आइडिया नहीं है, सो आई वुडंट वांट टू कमेंट ऑन समथिंग आई हैव नो आइडिया ऑफ.
Okay.
Men and women ka and in terms of gender driven, we all like for men there is already a lot of stigma associated कि अरे तू एक मर्द है तू क्या रो रहा है.
Exactly, so true.
That's it. So yeah, it might be difficult for men to open up because of the existing kind of environmental factors that are there या फिर societal जो factors हैं. And yeah, but having said that, it's not like men are more, women are less. मुझे इस बारे में clearly like I don't know.
Okay, alright, no issues.
Quantitatively more मुझे नहीं पता.
Okay, there's another like thing that I wanted to talk to you about is कि like चाइल्डहुड ट्रॉमा. ठीक है, हम लोग के टाइम में ये सीन था कि लाइक मम्मी से पापा से किसी से डांट तो खाना है, मार तो खाना ही है. दैट वाज लाइक कॉमन, लाइक चाइल्डहुड ट्रॉमा लोग कहते हैं, राइट? सो व्हाट काइंड ऑफ ट्रॉमास आर वी टॉकिंग अबाउट? लाइक मम्मी से मार खाना, पापा से मार खाना, वुड दैट बी कंसीडर्ड एज अ ट्रॉमा, या फिर व्हाट वुड बी लाइक अ चाइल्डहुड ट्रॉमा?
Anything that is a deeply say a disturbing emotional experience for you, that and जैसे आपने अभी कहा ना, like बचपन में हम सब मार खाते थे. And अभी तो we feel it's ठीक है. It's not ठीक है. It's not ठीक है. It's just something that we have somehow learned that अरे हाँ यही चलता आ रहा है तो यही चलते आएगा. It is not ठीक है for any parents to physically or emotionally kind of abuse their children.
What should a parent do? Like I don't know. I mean, like, just give me more info about it. I just want to know.
देखो, पहले तो मैं पेरेंट्स नहीं हूँ, लेकिन जितना तक
no,
मुझे
पता
है, I feel like at least have conversations with your children in a healthy manner. ये भी नहीं है ना कि you tell that अरे मैंने आज तक I have never raised my hand on you. So you're not doing a favor to that child, but by not raising your hand, that is something you're not supposed to do anyway. कुछ बड़ी बात नहीं है इसमें. Second is when we talk about trauma and child, जब बच्चों की जो childhood trauma होती है, it just doesn't come from beating and all of that. It also comes from emotional trauma. So if you constantly neglect a child, if you keep telling the child you're useless, you're worthless, the child is listening to all of this. And फिर बड़े होके वो वही definition याद रखता है.
Okay, and that would happen like subconsciously also, right? Like उसको पता भी नहीं होगा, but then he would like tend to be more angry, या फिर tend to do kind of like basically something wrong, right?
So ये जब आप कह रहे हो ना कि childhood trauma का हम बात करें, this even in terms of body image issues, okay, we have a lot of teenagers who are suffering from body image issues, adults as well, children. So when you tell a child you're of a particular color, अरे ये हमारे इंडिया में ये बहुत चलता है, अरे तू तो काली है, ये है वो है, even जब ये इंसान when they grow up, no matter the world tells them they're looking beautiful, but they have already had that thing in their mind कि बचपन से मैंने ये सुना हुआ है. So their whole idea of themselves is distorted. So that's the amount of damage you have done. That one statement of yours has damaged an entire person's मतलब self esteem को crush करके रख दिया है. और फिर मतलब that one statement. So you understand, right? Like the intensity of it.
Certainly, I totally get it, Song. And oh wow, I mean, these conversations with you about psychology is like blowing my mind. I'm like so many new inputs I'm getting, and I'm again extremely glad कि like you could make this time out and to me a time there, or at least to spread awareness or to have a conversation with me, and thank you once again कि like giving like at least helping me out to understand psychology better.
नहीं, this is my work. ये मेरा काम है. This is not even about thanking. ये मेरा काम है.
No,
it's
I mean,
part of my job.
Yeah, I mean, like spreading information is certainly something that should happen, especially about mental health and happiness and वगैरह. Anything else that you'd like to add on, Song? Any other thoughts that you have about psychology, या फिर as a human how we should do, और क्या करना चाहिए to try to keep us happy, या फिर anything else that you would like to add upon?
About happy तो नहीं, but I just want to I didn't, I should have added this way before when we're talking about therapy. So हम discuss कर रहे थे ना, how do I know that I'm going through something, and if I should go to a mental health professional or not उस वक्त. So I tell this, that you don't have to have any reason to go to a mental health professional. You might be totally happy, आपका life could be, all good, and you can still go to a therapist to explore yourself more. Okay, so you can do that. So you do, and also, please, like, this is to all of the people who will be listening to this podcast. Don't wait for that extreme, ki fine, after I have stopped eating and after I am not getting sleep for days, I'm going to go to the mental health professional. Please address it like right when you start feeling it's happening.
Certainly, and it is more dangerous than you getting injured or you're getting some disease. I'm pretty much sure about that. Yeah, and people tend to get, like, the suicide rates, just like you've mentioned, has skyrocketed, and I'm pretty much and especially during this COVID, right? I mean, that would have also affected so many people, right? For like, कि घर में trap रहते थे, and they cannot go out, and that would certainly affect so many people, right?
हाँ, अभी आपने एक बात कहा थोड़ी देर पहले कि it's more than an injury. नहीं, I wouldn't, I won't say कि ऐसा है. Fine, your physical health and your mental health are equally important, but injury की बात आई ना, तो एक चीज I'll tell you, picking up from that itself, कि when we get injured, जैसे if I get a fracture on my leg, okay, I will not leave it. I will run to the doctor immediately to get it plastered or something. Otherwise, I know this is going to get worse.
Yeah.
Right. I will not wait. और even अगर मेरा हाथ कट गया, फ्रैक्चर तो छोड़ो, मेरा हाथ कट गया भी, I'll apply Dettol or Savlon जो भी है immediately to that.
That is true.
Yeah. So same way, when we have emotional wounds, why do we keep it? कि wait, ये मुझसे हो जाएगा, रख दो इसको, रख दो, फिर इतना बड़ा हो जाता है ना, फिर out of control हो जाता है.
Yeah, so treat it immediately, right? Turant, yeah, exactly. That made so much sense, Song, and thank you so much for enlightening me with that. And yes, like, don't wait for it. Just go. अगर तुमको लग रहा है कि, and if you're seeing changes because of something or depression, whatever, go and get treated immediately, right now. Correct?
Correct.
Certainly. And I mean, again, it's all your knowledge in psychology that's pouring in, and I'm again so glad to have this conversation. And
knowledge, limited knowledge. I
know. I mean, see, everybody's learning, Song, right? Like, सब लोग सीख ही रहे हैं, right? And I think learning process never ends, and you always discover something new. Just like I've discovered today, so much like about psychology and mental health. And I would certainly recommend everybody, अगर तुमको लग रहा है कि अगर कुछ हो रहा है, like mentally, so definitely get treated and get counseling. That would certainly help out, right?
हाँ, बिल्कुल.
All right, great. So with this, I would like to end the conversation. I would certainly leave Songs, how to reach. How can people reach you, Song? I mean, is it through email, or do you also take in IG, Instagram DMs as well?
I take in Instagram DMs, but it's not very professional, to talk on Instagram.
Certainly,
I don't provide.
I mean, it's easy to access. It's easy to access, or easy to reach out to people. So how would you like to? How would you like to?
So I'm a male person. I'm a male person. If you don't find me anywhere in the world, just mail me.
Certainly. So I'll drop your email. I will add your email in the description, and anybody who thinks it would be anybody who wants to reach out to you can do. Hopefully, we'll definitely do more sessions like this coming forward, Song. And once again, thank you so much. For everybody listening, we are still on YouTube, and if you are listening this on Spotify, please take a moment and hit follow. Reach out to us if you have any questions, or if you want to join the podcast or come on a show, please reach out to us via mail, or you can DM us at Instagram as well. I would also put Songbriti's email in the description, and if you or anybody that you know is suffering through mental health issues, they can reach out to Song, right?
Absolutely right.
All right.
But yes, all the best to you for even hosting other podcasts also. Thank you. I felt really comfortable. Thank you so much.
I thank you as well. Awesome. Take care, and everybody listening. Bye-bye.